Hello, my name is Brittany, and today I'll be presenting on acute pancreatitis. This condition affects thousands of people each year and can become life-threatening if it isn't recognized early. In this presentation, I'll explain what acute pancreatitis is, how it affects the body, how it's diagnosed, and what steps can help prevent it. The purpose of this presentation is to help my community better understand acute pancreatitis. I'll go over the basic background of the disease, the signs and symptoms, who is most at risk, and the underlying physiological changes that make this condition so serious. I'll also explain the main diagnostic tools used by healthcare providers and discuss prevention strategies that can reduce the risk of developing pancreatitis. Acute pancreatitis is a sudden inflammation of the pancreas, which is an organ located behind the stomach. Normally, the pancreas releases digestive enzymes that stay inactive until they reach the small intestine. In acute pancreatitis, these enzymes activate too early and begin damaging the pancreas itself. This causes inflammation, swelling, and sometimes severe complications. Most cases require hospitalization because the condition can worsen very quickly. The most common symptom of acute pancreatitis is severe upper abdominal pain. This pain often starts suddenly and may radiate towards your back. Many people also experience nausea, vomiting, fever, and a rapid heart rate. The abdomen may also feel tender to the touch. These symptoms happen because the inflamed pancreas irritates surrounding nerves and tissues, and the body responds with a strong inflammatory reaction. There are several risk factors for acute pancreatitis. Some are modifiable, meaning they can be changed, and others are not. Modifiable risk factors include alcohol use, smoking, high triglyceride levels, obesity, and eating a high-fat diet. Non-modifiable risk factors include gallstones, certain genetic mutations, family history, and age. Gallstones and alcohol use are the two most common causes overall. Acute pancreatitis can affect anyone, but it's most common in adults between the ages of 30 and 60 years old. Gallstone-related pancreatitis tends to occur more often in women, while alcohol-related pancreatitis is more common in men. People with high triglycerides, obesity, or certain genetic conditions also have a higher risk. Understanding who is most affected helps communities focus on prevention and early detection. To understand acute pancreatitis, it's important to know what the pancreas normally does. The pancreas has two major roles. It produces digestive enzymes that help break down food, and it releases hormones like insulin and glucagon that regulate blood sugar. Under normal conditions, digestive enzymes stay inactive until they reach the small intestine, where they safely help with digestion. In acute pancreatitis, something triggers the digestive enzymes to activate inside the pancreas instead of the small intestine. When this happens, the enzymes begin breaking down the pancreatic tissue, causing inflammation and swelling. The swelling can compress blood vessels, reducing blood flow and worsening tissue damage. This process is often described as the pancreas digesting itself, which explains why the condition can become severe so quickly. One of the most important physiological changes in acute pancreatitis is the premature activation of an enzyme called trypsin. When trypsin becomes active inside the pancreas, it damages tissue and triggers a strong inflammatory response. This leads to severe abdominal pain because the injured tissue irritates nearby nerves and the swelling stretches the pancreatic capsule. This is why the pain is often intense and radiates towards the back. Blood tests are one of the first tools used to diagnose acute pancreatitis. Doctors check levels of enzymes like amylase and lipase. When the pancreas is inflamed, these enzymes leak into the bloodstream, and high levels strongly suggest pancreatitis. Lipase is especially important because it's more specific to pancreatic damage. Other blood tests may check liver enzymes, which can indicate gallstone blockage and triglyceride levels, which can help identify the cause. Imaging tests help doctors see what's happening inside the pancreas. A CT scan can show swelling, fluid buildup, or areas of tissue death called necrosis. Ultrasound is often used to look for gallstones, which are a major cause of pancreatitis. MRI or MRCP provides detailed images of the pancreatic ducts and can help identify blockages or structural problems. These imaging tools help determine both the cause and severity of the condition. Many cases of acute pancreatitis can be prevented. Limiting alcohol use and quitting smoking are two of the most effective steps. Maintaining healthy triglyceride levels and managing weight also reduce risk. For people with gallstones, early treatment or removal of the gallbladder can prevent pancreatitis from developing. Following a low-fat diet can help reduce strain on the pancreas and lower the risk of flare-ups. In conclusion, acute pancreatitis is a serious condition caused by inflammation of the pancreas. It often results from gallstones or alcohol use, but other factors like high triglycerides and genetics can also play a role. Early diagnosis is essential because the condition can worsen quickly. Prevention focuses on lifestyle changes and managing underlying health issues. By understanding how the disease works and who is at risk, communities can take steps to reduce its impact.